Good afternoon, everyone. My name is Marieli Moronta Sanchez. I am the Director of Community Outreach for the Rutgers Institute for Health, Healthcare Policy, and Aging Research. I am joined here today by Ms. Mariam Merced, who is the Director of the Robert Wood Johnson Barnabas Health Community Health Promotions Program in New Brunswick, New Jersey. This month, the Institute at IFH, we're launching an online series with a theme of communities of strength. During this month-long program, we are celebrating the Greater New Brunswick older adult community and sharing important health information. To kick off the series, we are hosting this important conversation focused on the challenges older adults have faced and the strength and resiliency they have shown over the past year. Mariam, thank you for joining us. And so this year has been incredibly difficult, especially for our older adults. The pandemic has created social isolation, economic distress, and painful losses to many families. From your vantage point in the health service field, could you talk a little bit about the collateral impact the pandemic has had on the physical well-being of the older adult community? And can you speak to the resiliency you have seen?
Thank you so much for the invitation and welcome to the team. We're so happy to have you. We need all the help we can get. What can I say? You're in a good place to work because your office is right above my office, so that's good. I'm also happy to be part of this initiative. The work that we do with seniors is critical. It's work that we haven't done for a long time, and we were happy to partner with the Institute of Health to make sure that we're reaching out to, the older population here in the city and in the Greater New Brunswick area, which includes like your Highland Park and your Franklin, and all these people receive services around New Brunswick. So it's important that we have the strategies to serve them better. Especially our older population. I also want to highlight that, the reason why I do this work was because of a group of seniors, right? When I came here from Puerto Rico to go to school at Rutgers, I worked as a security guard in a senior building, and they were the first one who asked me if I wanted to apply for the social worker position because the person was retiring to Florida. And they needed someone, and they knew I spoke Spanish, and they encouraged me. And this is a long time ago. I don't want to say the years, but it was a long time ago. But because of that effort, and I was never able to get rid of them because they are still around, or I have their grandkids or their great grandkids still part of the programs that we do. I was able to enter into this field of work that I love, and I will always remember their commitment and that network that they created that helped all of us, in the process of establishing ourselves in the United States. And I think that's part of the resiliency that I can talk about, our older population in many of our communities, the Latino community, the African-American community are the glue to the family. They are the ones who promote our culture, our language, our families staying together. So that talks a lot about their resiliency, their ability to adapt themselves to a different country, talks a lot about their resiliency. I've seen people live in this country for 40 years and never learn English because they have created that network between the church and the schools and the community-based organizations that support them, that have been able for them to be able to live in this country, at least in this city. But I also see that a lot of, the COVID-19 what compounded a lot of the social determinants of health that our community is already facing, like housing and violence and jobs, that all got compounded with COVID, and it affected in different ways our senior community. Many of them depended on their family to buy their medication, and their families were losing their jobs. Many of them needed to relocate and move with a son or a daughter or another relative because they couldn't stay by themselves where they were, and the family was concerned about them during the pandemic, so they needed to relocate. Many of our seniors are undocumented, and they still need to work. So many lost their jobs. Whatever chronic disease they have was impacted. And that ability to quarantine was very difficult in a city like New Brunswick, where rent is very high because we're a college town and we compete with students for housing. So the rent tends to be expensive for their other family member, that extended family. So it was hard for them to quarantine or have spaces that they can, be separated from the rest of the family. Food insecurity was something that we saw right off the bat was an issue, and their ability to go out and buy food was also impacted by COVID because they were afraid they could get sick, right? And they are part of that vulnerable population. So I think, the community in general, but COVID compounded a lot of the issues that we already were experiencing. They speak one language, they're monolinguals, there's lack of transportation, overcrowded housing, were issues that we were already having, and that with COVID, everything was aggravated.
Yeah, thank you. And I think that across, many communities, particularly minority communities of color, we've seen kind of the disparities, right, that have been absolutely compounded by COVID. So that, building off of kind of, how these social determinants of health have created some collateral health consequences, obviously brought on by and amplified by the pandemic. Could you talk a little bit about kind of what you and your team are seeing on the ground and how our neighbors are coping and thriving despite the additional stressors and challenges?
I think that the city of New Brunswick has worked very hard to connect the community-based organization to act as a safety net for our residents, right? It hasn't been an easy process because if you don't plan and you don't strategize and we work together, we just step on each other's toes, right? And all of this has to be based on trust, and that is something that you have to work constantly, right? So, but our city has been able to create a safety net around those more vulnerable community residents. So when the COVID-19 hit, we were able to use those partnerships, those networks to assist our more vulnerable population. And that meant, sharing resources, applying for funds during this time, and kind of sharing what everybody had, and also space and time, right? Many of the agencies were closed, but we needed to make sure that we knew someone that we could call in that agency that can return those calls so we can better assist our residents. The hospitals are a key a part of that structure, right? And Robert Wood and both the other hospitals, St. Peter's, were key in identifying, where were the hot spots in the community where we were seeing a significant amount of patients from the city, and then we were able to target those neighborhoods and sanitizers and the resources that the community had, and also being able to provide boxes of food. We also made a special push to make sure that our seniors had access to fresh fruit and vegetables, because we knew that many of the food pantries were not getting the supplies that they had gotten in the past. Especially they were not getting fresh produce, and we were able through the hospital to work with a series of down in South Jersey and in Philadelphia to make sure that we're bringing that food in here to give to our seniors so they can have some fresh fruit and vegetables, because many of them have already, chronic diseases that they need to have a certain, diet to keep themselves healthy through the pandemic. We knew very early on that, when the hospital asked me to translate the discharge instructions, and when I saw that, they said, go home, monitor your symptoms, because we knew we didn't have, the residents didn't have space to quarantine. They didn't have a thermometers, or if they had it, they didn't know how to read the thermometer. So we knew we had already some challenges in there. So we make sure that the staff was reaching out to our diabetic group, to our support groups that we have, to make sure that they understood what to do, how to use a thermometer, making sure that they have the medication they need for their diabetes or their high blood pressure. Like I said before, resources to give to the community. But it was all made out through partnerships that we had in the community, that we were ever able to respond, fast in an emergency way in the community.
Thank you. That's really, it really takes me aback to like learn about all of the different ways that communities have really come together and built these networks to support each other and pool resources. And so it really is kind of inspiring to see the community come together to support one another and figure out ways to make sure the needs of the community are met. Can you talk a little bit or give us kind of a snippet as we end this conversation about the local, hyperlocal resources that are available right now for the older adult community or the loved ones that care for them? Where are some places people can go for some resources?
So I think that the New Brunswick community, the Greater New Brunswick community, has been blessed with a new relationship with the Institute of Health. And we have been able to hire additional outreach workers to work with seniors here in the community. Especially here, we were able to hire somebody bilingual that is from this community, that was born and raised here, that has a big family here, is very well known in the community. And we have started creating those networks of seniors around the city, which is going to be important, and also creating that trust. They're doing virtual programming, as part of the Robert Wood Johnson University Hospital. We also have a fitness center at 100 Kirkpatrick Street that has educational programs, and also, a fitness program there that has a special fee for our New Brunswick residents. And we have many of our diabetics using the fitness center with a special voucher that we offer. There's also the Puerto Rican Action Board that has a number of programs there for the seniors, especially around weatherization and issues that they might have in the home. We have Unity Square, which is one of another community-based organizations that are open to serve the residents in the Unity Square neighborhood around Remsen Avenue. And in terms of healthcare, we have a federally qualified health center here, the Eric B. Chandler Health Center, that has bilingual staff. We also, St. Peter's University Hospital has also a clinic on Howe Lane that people can access services there. And I think that it's important to know that we are sponsoring different clinics for the COVID-19 vaccine. We just finished able to do over 1,200 persons from this community. We are going to continue with additional sites through FEMA during the evenings at one of the schools, and some Saturdays. People can call the 732-247-2050, and we will let you know when you can do an appointment to get your vaccine right here in your community. It is important that we tell our residents to look out for their seniors, right? To make sure that they help them get the vaccine, that they provide the transportation. If it's a technology issue, that they can assist them in register, to tell them where they need to go. We're currently working with our senior buildings to make sure that they have access or transportation to the new vaccine sites that we're going to be start opening through FEMA here in the community.
That's wonderful. Oh my God. Thank you so much for sharing all that great information. So basically go check out Mariam's team. They're doing amazing work with the senior community, the Puerto Rican Action Board, Unity Square, and among others. And so thank you, Mariam, so much for your expertise and this incredible information. And to the community, as a reminder, this month we will be sharing relevant health information and celebrating the older adult community and their contributions. Please hit the share button and follow us on Facebook and Twitter at Rutgers IFH. You don't want to miss these. Thank you.